Welcome to the Intuality AI podcast, the podcast from Intuality AI, where we try to predict the future. When through this COVID crisis, we have been doing podcasts looking at the data that has been coming out from around the world. And today we're going to also have a good look at the data and start doing some projections which other organizations have also done. Hi, I'm Dr. Howard Rankin, along with the chairman and founder of Intuality AI, Grant Rainier. Grant, how are you doing today?
I'm doing fine. As you know, we've been working hard on updating our system and getting as much good data as we can, having to do with the case increases and death rate increases of the coronavirus, not only in the United States, but for most of the countries around the world. And so we'd like to today focus just on the United States if we can.
Yes, and the data that you're about to show, I think, is important, and again, very important for the preventive measures we are taking. I think it emphasizes how critical that is.
Yes, and first of all, let me just go to our little description of what we do with our technology called Intuality AI. We are using it to provide daily predictions from its prediction engine for unrestricted free use in the worldwide war against the COVID-19 virus. We think it's important enough for us just to do this free and make it available to whoever might want to use it. The technology, in this case, tends to focus on predictive predictions, or rather preventive predictions, and it is also designed around the field of what is called behavioral economics. And our disclaimer is that the system called Intuality AI predictions are the sole result of the proprietary computer algorithm. And no staff or management of our company is able to or allowed to bias any of the results that we're looking at. They're coming strictly out of the engine. So I want to go to the pass it over to Howard to take it over, and we'll go through some of the charts.
Okay, so again, these are predictions made based on existing data and the Intuality AI system. There's no human interference in this. So let's get to them. What we're going to really focus on today, as I said, was the data. And one of the things that I think is important for people to understand about the increase in cases data is obviously the number of cases you come up with is defined by how much testing you do. And so we've seen, for example, in a lot of other countries that aren't really doing any testing, minimal number of cases. That doesn't mean that there aren't people affected. So the infection rate is a function of how many people you test. Now, there's news today that there is going to be released very soon tests that will be very quick, and I think this will result in a huge increase in the number of people tested, and as a result, a huge increase in the number of people that we'll see having the virus. What would you say about that, Grant, that issue of the unreliability of the data on contamination?
Yeah, that's been a major problem. I think everybody who is doing anything with this information is wrestling, especially with the numbers that are coming in for cases of reported virus conditions of people, as opposed to the death numbers, which are probably rather reliable because they're, I would imagine, based on death records coming out of institutions like hospital and healthcare facilities. So we know that, as you mentioned, the increase in testing and the more efficient that becomes, we would expect that the rate that is being reported for cases and new case rates is going to increase, I would imagine, rather dramatically. But at this point, we don't know what that is, and all we can go with is the information that is being reported to us through various sources.
Yeah, absolutely. So expect to see, as testing increases, expect to see a big spike. Again, that's going to be a function of testing rather, although it would give us perhaps a more accurate picture of what's going on. One of the things that a friend of mine, David Katz, who's been on national media in the last few days after he was quoted a lot in the New York Times about different ways of controlling the virus. He said that he hoped that there were government and academic organizations who are actually doing randomized trials here, looking at, say, 1,000 people randomly and following them and finding out as much as they can about not just the spread of the virus, but all sorts of other characteristics and associated variables. So when we emerge from this, we actually have learned from it, not guessed from it. And obviously that's what we're about too. We're trying to learn from it, in this case, learn in advance rather than guess. Grant, you have some data then on predictions about deaths.
Yeah, let me go to that and show that to you. The information that I'm going to show you are basically two charts. We're only going to concentrate on the United States at this point, as opposed to all of the other charts and information we've got for basically all the countries in the world. But I think everybody is really wondering how it's going in the United States. So this first chart is the system's prediction of the number of cases based on the rate of increase per day. And this, we've limited to going out 15 days in advance. So on the lower left-hand side, you can see that it's starting on April 2nd, which is today, and going out to April 16th. And by looking at the y-axis, we can see that the system is predicting that a rate of increase, daily increase, is going to be about 300,000 new cases per day at April 16th. And there's a sort of a exponential growth of that up to that date.
Right. So that is predicting, as you say, April 16th, 300,000 new cases. Again, that also assumes we have the functional testing capacity to actually test that many people. But it's also based on what we're seeing right now and just extending that out over the next 2 weeks. Of course, one of the questions is, are the social distancing and other measures that are, hopefully people are taking seriously, are they going to impact that and rate and bring it down rather than continue the way that it is?
Right. So these are the, this is the graph for the number of cases. And next I want to show you the graph for the number of deaths that are being predicted. This is it. It's for the same period going out to April 16th. And on April 16th, it's saying that the number of deaths per day will be increasing at the rate of about 25,000. And while that sounds awfully high, that's what the system is coming up with. And I'm going to go to, we'll talk about this a little bit, but next we'll go to showing you how this compares to a few other predictions and in history as well.
Right. So what that's predicting is, you can see the increase in deaths per day over the next 2 weeks. And on April 16th, looks like 23,000 or so actually that's April 15th, 23,000 deaths on that day, which sounds staggeringly high and horrendous. But again, that is based on the existing data that this will double every 4 days. And that's almost 16 days away. So that's what it comes out to.
Yeah. And so just to maybe put this in perspective with everything that everyone has heard about what is predicted over the next month here, I'm going to go to another chart that will put this in context, hopefully. This is a comparison of Intuality AI predictions to others that are out there, and there aren't many, but there are a few. And we've tried to hunt them down and to show how they compare to what our Intuality AI system is predicting. So on the right side, left side are the lists of the various sources of information. And on the right side is the death rate per day table. And it's divided into two parts. One is actual, and the other one is predicted. And the actual is where we've taken the data for the last 10 periods, the 10 days of these various sources. And these are real numbers going back 10 days from today. And for example, Johns Hopkins, based on their data, shows a 22.8% increase per day of death rate. Another organization called Worldometer is showing a 32.5% increase. The European Center of Disease Prevention and Control, part of a subset of the EU, is showing 31.5%, which is pretty close to what the Worldometer is also showing. And then finally, there is an organization under healthdata.org called IHME, and they actually have some predictions. And their prediction going forward to 10 days is a daily death rate of 11.4%. And that's quite different than the rate that Intuality is predicting of 23%. And to put it in perspective with the other ones, you can see that Intuality's rate is not far off of what it's historically been over the last 10 days. So that's pretty good example of how well Intuality is doing, it seems, compared to what has been historically happening.
Now, it's interesting when we take the IHME data of 11.4% increase per day, their prediction, and if you compare 11.4 to 23%, out 15 days, their prediction on April 15th isn't 23,000 deaths. It's actually, they say somewhere between 2,000 and 4,000 deaths. They actually put it at like 2,600, something like that. And that shows you the difference with the continued increase. Now, presumably, they're factoring in some decrease in the rate simply because of the measures we're taking, and let's hope that actually is the case. But as you say, they're working really more on an 11.4% increase as opposed to a 23% increase. And stretched out over time, that makes a huge, huge difference.
Yes, it does. As everybody knows, compounding these rates on a daily basis can make a big difference between the 23% and the 11% over just a week or two.
Yeah.
So that's significant.
Yeah, absolutely. And so we actually hope that they're right. Only time will tell. And this is why it is so critical that all of us, absolutely all of us, comply with the measures that we're being asked to do to stay homes, shelter in place, do not go out unless it's absolutely necessary, take all the precautions we can, because we have to get this thing under control sooner rather than later. And again, this is just predicting out 2 weeks. And we want this thing to be on the downward spiral as soon as possible, because God forbid you stretch out AI's Intuality's predictions over 4 weeks at that rate. And, you know, that's going to be unimaginable. Well, it's calculable, but we don't want to imagine it. So
that's true. We've said this before in prior podcasts, but Intuality AI is a system that is running 24/7. And as soon as any information comes in from any source that we're attached to, it is being processed and updated. And the output is being converted to charts that are like the ones we've shown you. And again, we've only today focused on the United States, but we have the same kind of charts for all of the countries in the world, basically. And they're quite interesting to look at. And we may go there in following up podcasts here that we're going to be doing rather frequently.
Yes, certainly. And now that this prediction is out there, we will definitely be doing regular podcasts to update that. Obviously, each day's data as it comes in influences the prediction, and you can see how what seems like a modest change in the percentage rate can make a huge influence in prediction down the road. So we absolutely will keep you updated as the system updates, as the data comes in, and more of it will come in because of testing, I think. Anything else, Grant?
Yeah, I wanted to mention that the system produces what are called actionable alerts, and for anything that's analyzing. And so we are going to be looking for actionable alerts coming from the system that will, at this point, be alerts that the curve is flattening and will be turning down in the near future. And as soon as those come out, we'll be reporting those as well.
Yeah, absolutely. We want to get the quickest lead we can on a downturn in this situations, or an upturn from a health point of view, that we're getting beyond the worst of it. But clearly, nobody's sure where we are right now. Yes, you can look at other countries and see what seems to be happening there. But again, the data, maybe the death data is reliable, but some of the other data is unreliable and depends almost exclusively on how much you're testing and also who you're testing. If you're just testing people who show up at a hospital complaining of symptoms, that's one thing. If you're testing large numbers of the population as well, that's something else. So again, that's part of the reason why we're focusing on deaths, but also they're clearly more important. That's what we're hoping to avoid.
Right. I'd like to add, Howard, that we have so much information, so much output. We are deciding what we should show and what we shouldn't show. So we would really appreciate the people who are watching to do a text through Facebook or through YouTube and tell us what you'd like to see. And again, it's a process of trying to figure out what's most interesting to the people viewing this podcast. And we could certainly and would welcome your recommendations as to what information, in one case, for example, what countries you might want us to show you charts on. That would be very helpful.
Yeah, and believe you me, when Grant says he's got data, he's got data. He's got data, I think, really from all around the world in every country, on infection rate, on death rate, and the curves for each of those countries. So those of you who are watching who are interested in not just the USA, at other countries, drop us a line, leave a comment, and we will make sure those are included in the next podcast.
Very good.
Okay.
Thank you very much.
Well, thank you, Grant. I know you've been working really hard on this 24/7 to get the system updated, getting all the data inputted. And as we say, just said, you got data from every country that's reporting it, which right now is about pretty much everyone. And, phenomenal job you're doing. So thank you. And let's make sure we can keep people updated as much as possible over the next few days and few weeks.
Absolutely.
Okay. Take care. Take care, guys, and we'll be back with you shortly.